Hello friends, welcome back to Cortex YouTube channel. In this video, I'll be focusing on paracetamol poisoning, its clinical aspect and management. Okay, I will not be covering the details of paracetamol pharmacokinetics, what happens when you ingest normal dose and when you ingest overdose, and how it causes liver injury. Details of which will be dealt in separate video, because if I cover that here, the whole point of focusing on that management aspect will be diluted. So that video will be dealt in a different video. Okay, that topic will be dealt in a different video. So in this video I'll be focusing mainly on clinical aspect, clinical presentation, and what we have to do immediately in the emergency room. So you have to know what is the therapeutic dose. The safe dose of paracetamol is up to 4 grams per day when you have normal liver. 4 grams per 24 hours. So toxic dose is 10 grams per day, 10 grams per 24 hours. So in pediatric it is 150 to 200 mg per kg per day is the toxic dose. Okay, what is the toxic metabolite? Toxic metabolite is NAPQI, that is N-acetylparabenzoquinone N-acetylparabenzoquinone. So this is the toxic metabolite. So uh, let's suppose a patient presents with consumption of this much toxic dose of paracetamol. What to do? What are the clinical features? Clinical features. These clinical features of the paracetamol poisoning or acetaminophen can be grouped into 4 stages. Stage 1, which may last up to 24 hours, which is majorly asymptomatic. Asymptomatic patient may not have any symptom at all, or if at all, if he has symptom, that would be anorexia, nausea, vomiting. Okay, here LFT will be normal. LFT will be normal. Stage 2 is liver injury stage, that is it lasts after 24 to 72 hours. Okay, here you will see increasing AST and ALT. Liver function will be altered. Your INR will start increasing. Your bilirubin will increase. So all these, and they may have right upper quadrant pain and tenderness. So basically liver injury started and peaks in this second stage. So this is called a stage of liver injury. Okay, in stage 3 what happens? There is it may last from 72 to 96 hours. So here hepatic failure will happen. In stage 2 only injury was there, now liver is failed here, and acidosis will happen. Okay, renal failure will happen, basically organ failure, multi-organ failure. Okay, then in stage 4 what happens? Either recovery, that is after 5 days, either recovery or death, death due to acute liver failure. So this is about clinical features. Most of the patients will present in stage 1, and only 5% of them will progress to stage 2. So acetaminophen poisoning or paracetamol poisoning is the leading cause of acute liver failure in US, UK, and most of the European countries. So this is about the clinical feature, and now let's focus only on management. So toxic metabolite is NAPQI. The antidote is here. Antidote here is N-acetylcysteine NAC. Okay, this can be given per oral or IV. So you have to give per oral in majority of the cases, but when you can give IV is in pregnant woman, intolerant vomiting, patient is having vomiting, severe vomiting, you can't give oral, that time you have to give IV. And in CNS depression cases, like comatose. Okay, risk of aspiration is there. You have to give IV. Okay, then both are equally efficacious. You can start with any oral or IV. Now, how to give IV? This, you know the antidote. Okay, you know the antidote. How to give it? So whenever a patient consumes with a toxic dose of paracetamol, acute consumption, acute single dose of consumption. Let's suppose he has taken all the toxic dose now itself. So how to give? You have to initiate as early as possible, and it doesn't work after few hours. Okay, you have to give as early as possible. Now, how to give? We for IV, for IV, this is per oral, this is IV. Per oral we follow 72-hour protocol. IV we follow 21-hour protocol. So let's discuss IV first. It is 21-hour protocol. You know what to give, that is NAC. How to give? We have to give, this is 21 hour, no, it is divided into 1 hour, 4 hour and 16 hours. 16 plus 4, 4 20, 20 plus 1, 21 hour. So in first hour you have to give 150 mg per kg of NAC. Obviously NAC in how much ml what is the solution? That is 5% dextrose. 5% dextrose is the fluid of choice in 200 ml. Only volume changes but fluid remains same. So and dose of the NAC also changes. It is 150 mg per kg of NAC. Here in next 4 hours you have to give 50 mg per kg of NAC in 5% dextrose in 500 ml of 5% dextrose. Next over 16 hours you have to give 100 mg per kg in 1 liter of 5% dextrose. So let's suppose the patient is 100 kg. So first you have to give 15 grams in 1 hour. Next you have to give 5 grams in 4 hours. Next you have to give 10 grams in next 16 hours in 5% dextrose in 200 ml, 500 ml, 1000 ml of 5% dextrose. So fluid remains same, only dose and volume of the fluid changes. Now in per oral dose you have to give 140 mg per kg loading dose. Then every 4 hours you have to give 70 mg per kg. About 17 doses it has to be given in 72 hours. So this is doses. So this is the doses of antidote, that is NAC. Okay, obviously if the patient presents within 2 hours, 1 to 2 hours, 30 minutes, 1 hours, 2 hours of consumption, you have to give gastric lavage. Okay, and you have to obviously monitor LFT and all. So this is me. This video is only on focuses only on management, clinical aspect, and antidote dosage. Okay, so details of about like paracetamol kinetics, what happens when consumed in therapeutic doses, toxic doses, how it causes liver injury, and details about the stages, all will be dealt in the future video. Stay tuned for that video. Hope you find this video useful. It is a short crispy video. Okay, if you find informative, please share among your friends. Thank you, and see you in the next video. Thank you.